Opioid overdose prevention and response training, a project of the San Diego LGBT Center and A New Path.
Training details, LGBTQ and substance use facts, local opioid overdose statistics, about opioids, recognizing and responding to opioid overdose, how to contact emergency medical services, how to use naloxone. Substance use is ingrained in the LGBTQ2S+ community. Historically, bars and clubs have been the only social outlet for LGBTQ2S+ individuals. Alcohol and other drugs have also provided a coping mechanism for many to find relief from the stress and internalized shame that comes from discrimination. Communities are also more likely to experience depression, which leads to increased alcohol and drug use. Substance use is 37% higher among LGBTQ2S+ people. Including this community has an impact on community-level prevention effectiveness as a whole. The highest instances of crystal meth use are in the LGBTQ2S+ community, particularly trans women and men who have sex with men. Opioid use in the LGBTQ2S+ community contributes to a significantly higher danger for fentanyl overdose. 1.1 million LGB adults 1 million LGB adults reported prescription pain reliever misuse. 12% of white youth attempted suicide compared to 21% of Native Indigenous youth, 20% of Middle Eastern, Northern African youth, 19% of Black youth, 21% of multicultural youth, 18% of Latinx youth, and 12% of Asian Pacific Islander youth. 14% of LGBTQ youth attempted suicide in the past year. 45% of LGBTQ youth seriously considered attempting suicide in the past year. LGBTQ youth reported having used a prescription drug that was not prescribed to them in the last year, and this rate was the same for those under and over the age of 21. Both Native, Indigenous, and multiracial LGBTQ youth had greater odds of reporting regular prescription drug misuse compared to white LGBTQ youth. Regular prescription drug misuse was associated with nearly 3 times the greater odds of attempting suicide in the last year among both LGBTQ youth under age 21 and LGBTQ youth ages 21 or older. 462 fentanyl-related deaths in San Diego County happened in 2020. The number rose to 814 fentanyl-related deaths in San Diego County in 2021. Over 108,000 individuals died of an opioid-related overdose in the United States from February 2021 to February 2022. Opioids can be natural or fully semi-synthetic, entirely man-made drugs. Opioids diminish the perception of a reaction to pain. They also produce feelings of euphoria. Heroin and some prescription medications, such as morphine, fentanyl, oxycodone, codeine, methadone, and buprenorphine, are also opioids. Opioids bind to an active receptor in the brain, triggering the release of dopamine, a neurotransmitter linked with learning, pleasure, and reward. Over time, opioid use changes both the amount and sensitivity of receptors in the brain, leading some people to restore dopamine levels by continuing their drug use. Types of opioids include heroin, fentanyl, morphine, oxycodone, Vicodin, hydrocodone, Percocet, and codeine. A very small amount, 2 milligrams, can be fatal. Pharmaceutical fentanyl was developed for pain management treatment of cancer patients, applied in a patch on the skin. While Mexico and China are the primary source of the United States, India is an emerging source for finished fentanyl powder and chemicals. It is often cut into counterfeit prescription drugs sold on the street, and it is now showing up in many street drugs including cocaine and methamphetamine. Other names for fentanyl are Fetty Wap, Apace, Blues, China White, and Dance. China White, and Dance. Fentanyl safety tips. If you touch fentanyl, it can be removed from the skin with soap and water. Alcohol-based products, such as hand sanitizer or wipes, may increase fentanyl absorption. Powdered fentanyl does not penetrate the skin very easily, but avoid touching lips or OD. Carry naloxone and fentanyl test strips and be familiar with them for your clients, loved ones, or partners. Naloxone is a prescription medication that reverses an opioid overdose. It cannot be used to get high and is not addictive. Naloxone is safe and effective, and paramedics and doctors have used it for decades. Naloxone is also called by the brand name Narcan. Naloxone is an opioid antagonist. The brain has many receptors for opioids. Too much of an opioid fitting into too many receptors slow and stop the breathing. ODs can be instantaneous or over a longer period of time. They can happen as a process. Someone could slowly stop breathing. They usually happen 1 to 3 hours after the drug was used if a person is actively using, whether it be licit or illicit. With fentanyl or carfentanil, it can happen instantaneously, and with new users, it can happen instantaneously. Mixing drugs and using without medical supervision. Benzos are common in opioid overdoses. Uppers and downers do not cancel each other out. Mixing opioids and stimulants actually increase risk for overdose. High dosages of opioid use. Using alone. Change in dealer, product, method of taking. Concurrent medical conditions. Naloxone has a stronger affinity to the opioid receptors than the opioid themselves. It knocks the opioid off the receptor, allowing the person to breathe again and reverse the overdose temporarily. Blue or purple fingernails and lips. Unresponsive to voice or touch. Pinpoint-sized pupils. Slow heartbeat or low blood pressure. Pale or clammy skin. Slow, irregular, or stopped breathing. If you've seen enough to be worried, you check on them by tapping their foot, asking if they're all right or okay, saying something alarming. If no response, try a sternum rub. Rake your knuckles across the person's breastbone hard. This is enough pain to wake them up, if any wake them up. If still no response, proceed with OD recovery procedure. Please note, if the person is experiencing another form of medical emergency that is not related to an opioid overdose, naloxone will not harm them. Call 911 and let them know your location and that someone has stopped breathing. Administer the first dose of naloxone. If no response, administer second dose of naloxone no more than 1 to 2 minutes after the previous dose was administered. Rescue breathe if your supply of naloxone is depleted. Services arrives. The California 911 Good Samaritan law states that if you witness an overdose and call 911 for help, you are protected. It shall not be a crime for any person who, in good faith, seeks medical assistance for a person experiencing a drug-related overdose to be under the influence of, or to possess for personal use, a controlled substance analog, or drug paraphernalia. The person experiencing an overdose is also protected from these offenses. Let them know what has happened. Explain that they have overdosed and you administered naloxone. They may be in withdrawal from the naloxone. Stay with them and monitor their breathing. Inform them that in 20 to 90 minutes and that the opioid is still in the body. The overdose can come back once the naloxone wears off or if they use again too soon. If paramedics are not coming, the person should visit a doctor as soon as possible. They could have fluid or vomit in their lungs or have other medical complications. If you use your naloxone, tell your prescriber. There is no punishment, and you get new doses. Naloxone is also available at the pharmacy without an outside prescription if you or your loved ones want additional doses. It is also available at all San Diego County Health and Human Service agencies and other local organizations, including NAMI San Diego, Harm Reduction Coalition of San Diego, On Point, Say San Diego, Mental Health Systems North Inland, and Episcopal Community Services.
Opioid overdose prevention and response training. A project of the San Diego LGBT Center and A New Path.